My name is Dan Foti. I'm a professor of psychological sciences at Purdue University. Seasonal depression is a major change in mood and behavior that occurs in the wintertime. It's very common to hear folks talk about the winter blues, which is a more normal, more mild shift in our mood during the winter. It's normal to feel a little bit lower in energy, to feel a little bit listless. Seasonal depression, on the other hand, is a much more significant change in mood. So this is actually a form of major depressive disorder where the episodes of depression start in the fall and then persist throughout the winter months. In other words, this is a diagnosable psychological disorder. And unlike those winter blues that are often caused by just changes in the winter weather, changes in our daily routine, maybe some holiday stress, seasonal depression is directly caused by the seasonal change itself, specifically that change in sunlight exposure that disrupts our sleep-wake cycle, has an effect on mood, and ultimately in some folks causes seasonal depression. Seasonal depression is different from the winter blues in terms of the specific signs and symptoms as well as the overall severity. In seasonal depression, we tend to see a very low mood that persists for a few weeks at a time, and there's a few other symptoms that go along with that. There's some major changes in bodily functioning, including sleeping way more than we normally do, maybe eating way more than we normally do, and feeling very fatigued. There's some cognitive symptoms, in particular difficulty concentrating, for folks where normally that's not a problem for them. And then sometimes folks will have these low mood, bodily symptoms, cognitive symptoms, as well as some feelings of hopelessness. And overall, these symptoms combined and the severity of them tends to make it very difficult to function in day-to-day life. Difficulty taking care of ourselves, difficulty taking care of our loved ones, going to work, going to school. And I would say if these symptoms pop up for a day or two, that's not seasonal depression, that's just a bad day. But if you notice these symptoms cropping up and persisting for a few weeks or more, it might be seasonal depression, and that would be the time to get a professional evaluation by a trained healthcare professional. Seasonal depression is somewhat common, and there's good evidence to show that about 1 in 20 people will develop seasonal depression. And there's some pretty well-established risk factors. One interesting risk factor is latitude. It's where you live relative to the equator. So rates of seasonal depression, the relative risk is lower in more tropical regions, closer to the equator where they get more sunlight. And the risk is much higher in northern regions. Think Alaska, where there's big differences in the amount of sunlight throughout the year, which can increase risk overall for seasonal depression. But there's no one-to-one cause here, right? There's a lot of factors that can increase risk for seasonal depression, including some biological factors. For example, there's evidence showing that how much melatonin your body naturally produces, melatonin being one of those hormones that helps regulate the sleep-wake cycle, as well as some genetic factors that also help regulate the sleep-wake cycle. That these factors also combine with environmental risk factors to potentially cause seasonal depression. Why do people get more depressed in the winter months? For a lot of reasons. The winter months change our daily routine, so we're limited in our ability to do outdoor activities that we like doing. We might be a little bit more sedentary than we normally are during, say, the spring and summer months. And there's changes in our day-to-day routine, as well as the stress of the holiday season, which might involve, say, family stress and things like that. All of that can have an impact on our mood. And on top of all of that, there are disruptions to our sleep-wake cycle. Our sleep-wake cycle is heavily regulated by direct exposure to sunlight. Sunlight is a cue for your brain and body of when it's time to wake up and when it's time to go to sleep. And that has a strong association with our mood. And so when that gets disrupted in the winter time because there's less sunlight, that can disrupt our biological rhythm and have an effect on our mood. There are a lot of good treatment options that exist. The good news is many of the same treatments that work for depression in general are also quite effective for seasonal depression. This includes cognitive behavioral therapy, which is a structured form of talk therapy that involves a set of skills to help combat persistent negative thought patterns, as well as to help regulate day-to-day behaviors and keep our mood on track. Many FDA-approved medications, antidepressant medications, that again are effective for depression generally, are also helpful for managing the symptoms of seasonal depression. And there's one unique treatment that is specific to seasonal depression, and that's light therapy. Light therapy involves a special device called a light box, which emits full spectrum light that mimics sunlight. So this is quite a bit different than the lights in your office or your desk lamp at home. This is mimicking the experience of getting that direct exposure to the sun that you would get normally in the spring and summer months just by being outside. And the treatment involves a few minutes of regular daily exposure to that light box every day, typically in the morning, shortly after you wake up. This can help regulate your body's sleep-wake cycle, get you back on track, and help alleviate those symptoms of seasonal depression. I want to emphasize that normal day-to-day changes in our mood are normal. It's very typical. And there's a big difference between having a bad day and having a bad month. And so if you or anyone that you care about is noticing a big shift in how they're feeling, they don't feel like their normal selves, their mood is changing, it's having an effect on their ability to think, concentrate, sleep, eat, interact with other people, there might be something going on. And the good news is requesting a diagnostic evaluation from a trained healthcare professional can give you the answers and point you toward next steps to get your mood back on track.